This is Andrea Kane, and we are here to talk about The Language of Medicine, 12th edition by Davy Ellen Chabner for HSC 114. And we are now on week 7. This is chapter 15 in your book, and we're going to cover the musculoskeletal system. If you look at your syllabus, you'll notice that the musculoskeletal system is Unit 11. So if you're looking for learning objectives and those types of things, look under Unit 11 in your syllabus. But we're chapter 15 in the book, musculoskeletal system, which means muscles and bones. As always, we have pretty similar chapter goals. We look at the structure and function of whatever it is that we're studying. In this particular lecture, we're going to talk about the process of bone formation and growth and talk about the major bones of the body. Now, this is not anatomy and physiology, so we're not going to get too terribly in-depth. Your textbook will go into it a little bit more in terms of detail, but really the majority of what you would learn would be in an anatomy and physiology class, which I hope you'll take. We're going to look at those combining forms, prefixes, suffixes, abbreviations, all sorts of things like that. And then we'll talk about conditions. In this chapter, we will be talking about fractures. We'll talk about lab tests, clinical procedures, and then make sure you have a couple of quiz questions to check your learning. All right, so here we go. What is your musculoskeletal system? It is made up of bones, muscles, and joints of the body. So that's what we're talking about. That's what we're talking about here today is bones, muscles, and joints. What are bones? They are the structural support and they protect your internal organs. But that is, you can sort of think of them as if you're building a house, these are your support beams. These are what all the weight rests on. They are the strength that hold together your shell so that you can withstand other things. Your muscles allow internal and external movements. Your muscles move your bones. And then your joints are where bones come together, and the type is determined by the need for flexibility. For instance, your elbow bone flexes differently than your ankle bone. Then actually there's multiple bones in your ankle, so don't get me wrong there. But if you'll notice in your hands how they flex, it's a little bit different than your shoulder or your neck. Your tendons bind your muscles to bones. Now you're going to need to know the difference between tendons and ligaments. So make sure you study that. Tendons bind muscles to bones. Ligaments bind bones to other bones. So if you're talking about a ligament, it's bone to bone. Tendon is that muscle to bone connection. Okay, let's move on. So what are some physicians that are associated with the musculoskeletal system? Because you'll hear several different ones, and you'll see their abbreviations and what that all is. Historically, some people have thought that osteopathic physicians are not as good as medical doctors, MDs, and that is simply not true. They have slightly different training. But they are every bit as qualified as medical doctors, even outside the musculoskeletal system or orthopedics. You can have osteopathic physicians who are fabulous primary care physicians. They can even be intensivists that work in ICUs and work on trauma cases. They can be surgeons. So don't let the initials throw you off. I'm not quite sure why they put them on here, but it's something to be aware of. And then we'll probably touch base a little bit on rheumatology and a physiatrist. You should also be able to see these things in your book for more detail, or have fun on the internet and look those up and learn about the differences in their training. But know that they are all physicians that are associated with the musculoskeletal system and all very well trained before they go out to practice. So bone formation, how does this happen? It's called ossification. Ossification. It's where cartilage is replaced with bone. One place where ossification does not happen is in your nose. Your nose is made up of of cartilage. There is a nasal bone behind there, but that's not something that happens. Your ears would be another example of something that is cartilage that does not become ossified or go through the process of ossification. But for all of your other bones, originally many of them were cartilage and then they grew into bone. So what are some of the cells that are associated with this? There's osteoblasts, osteocytes, and osteoclasts. I'm going to let you read up on those. There's some good information in your textbook. The osteoblasts and osteoclasts work to deposit and tear down bone throughout your life. So they're working even now, and they'll be working 20 or 30 years from now. They may be working 70, 80, 90 years from now, depending on how long you live. The skeleton is a source of calcium. Our bones have calcium, and they need calcium. It depends, again, next point, on calcium, phosphorus, and vitamin D. And as we've learned before, looking in the endocrine chapter, no, not endocrine, was it endocrine? I think it might have been, about how you have to have vitamin D to absorb calcium. The chapters are starting to blur together. I apologize for that. But so remember, we just finished studying that. Calcium phosphate enzyme then helps create hard bone from those sources. Bones are a reservoir for storing calcium. Basically, they're a holding tank. And they keep that calcium stored and release it when it's necessary for nerve transmittal to muscle, including heart muscle and muscles attached to bones. Your calcium level is maintained in your blood by that parathyroid gland that secretes that hormone to release calcium from the bone. Remember, we just studied about this in chapter 18 in week 6, and this is where you see it starting to come together, and you can see the influences, that it's not just bones, muscles, and cartilage and ligaments and tendons. It's all of these cellular level activities that are happening, whether you're talking about nerve transmittal or you're talking about the hormone. It's fascinating, really, when you get into it. So bone structure, you can have long bones, short bones, flat bones, sesamoid bones. Each bone may have a I'm sorry. Diaphysis, epiphysis, metaphysis. Sorry, I'll spit it out there eventually. Diaphysis, epiphysis, metaphysis. You'll more likely hear shaft and you may hear about epiphyseal lines or plates. I don't usually hear those terms, diaphysis, epiphysis, and metaphysis. That's usually something that's not necessarily all that common, but you do need to understand and know what they mean. So for the purposes of this class, make sure you make some flashcards on those. The epiphyseal line or plate is your growth plate. Have you ever heard about someone who shattered their growth plate and they had problems afterward? This is where it talks about. This is where the cartilage is replaced by bone for bone growth. And this is why those types of fractures are so severe and so in need of extra care. Well, if you look at the interior of the bone, there is a structure. There's articular cartilage, your epiphyseal line or plate, cancellous bone, compact or cortical bone, medullary cavity, and periosteum. And those are all types of interior bone structure. And this is a really good graphic to show us exactly what that looks like. So it's taking a bone and it's showing you, if you start, you can start either at the top or the bottom, and it shows you all the different types of things that you would run into. The medullary cavity is where your bone marrow is kept. And then the graphic on the right-hand side shows you if you did a cross section of that bone, what would it look like? How you can see the cancellous bone in the middle surrounded by the compact bone on the outside of that, and then that's all surrounded by the periosteum. The ends of your bones are covered by articular cartilage in the joint that cushions your joints and allows them to move. So if you ever hear of someone who takes glucosamine chondroitin for their joints, they're actually trying to build up that cartilage that gets worn down over time. Compact bone that has Haverian systems for blood vessels, nerves, and yellow bone marrow made up mostly of fat. Your cancellous bone, also known as your spongy or trabecular bone, which again, notice that you're going to need to know all three, that cancellous equals spongy equals trabecular. Those spaces contain red bone marrow with elements for blood formation. Okay, so notice that you've got two different kinds of bone marrow. One is used for blood formation, which we talked about in the blood system, and that was at the beginning of week 6. And the other one has yellow bone marrow. And notice that they're in different parts of that bone. They're not together. And this just talks about what they are, and we talked a little bit about how hematopoiesis is the production of all those types of blood cells in the bone marrow. All right, did you know your bones have processes and depressions? They have processes. These serve as attachments for muscles, tendons, and ligaments. Remember that, muscles, tendons, and ligaments. Depressions are openings or hollow regions that help join bones or serve as passageways for nerves or vessels. So this is a view of that. The left side is your femur, which is your thigh bone, and the right side is your humerus, which is your upper arm bone. This shows you where there are processes and depressions. Can you see those? Processes stick out. Depressions are bend in, so to speak. Create a hollow or a dip. Well, let's take a look at your cranial bones. This is looking down at your head from the top down. This is as if we are above someone and someone has cut their head in half and we are looking down. Anterior is the front of their head. Their posterior is, of course, the back. The foramen magnum is where the spinal cord neck portion is, just to kind of give you a visual. Ethmoid bone is sort of nasal, that type of area. All right, so that gives you a chance to look at those bones. You have multiple bones that make up your skull. And this is a picture of that. And here now is from the side. And you can see all those bones again. And this just goes through and lists those: the frontal bone, parietal, temporal, occipital, sphenoid, ethmoid. And this is from the front, if you were looking at someone's skeleton head on, face to face. And the facial bones are nasal, lacrimal, maxillary, mandibular, zygomatic, and vomer. You have air cavities located in your facial and cranial bones that lighten up your skull and warm and moisten the air as it passes into your respiratory system. What do those sound like? Sinuses. Has anyone ever had sinus pressure, sinus inflammation, sinusitis, those types of things? That's those air cavities. So now let's look at your vertebrae or your spinal column, and let's take a look at the different sections. Did you know you had sections of your spine? The first 7 bones are called your cervical vertebrae, and they are for your neck. The next ones, there are 12, are thoracic vertebrae. These hook in with your ribs, and they protect a lot of your internal organs. The next 5 are called lumbar. This is lower back. So if you've ever heard of somebody with lower back pain or lumbar pain, or something wrong with their lumbar discs or vertebrae, that's where it is. It's lower back for those 5. And then your sacral vertebrae is made up of just the sacrum, and then at the very bottom is your coccyx bone. And that, have you ever heard of your tailbone? That is all that piece there. So you have 26 bone segments from the base of your skull to your tailbone. They're in 5 divisions, and you need to know all this. So this is a really good one to study to make sure that you know. And then your bone segments are separated by pads made up of cartilage, and those pads of cartilage are called intervertebral discs. Intervertebral discs. So you have those in those regions. All right, let's talk about the bones in your thorax, pelvis, and extremities. In your thorax area, it's your clavicle or your collarbone, scapula, sternum, and ribs. In your pelvis area, you have a pelvic girdle, an ilium, an ischium, and a pubic bone. In your arm and hand, you have humerus, ulna, radius, carpals, metacarpals, and phalanges. So let's look at, I thought they were going to give us a graphic for the hand and the arm. Sorry about that. Got excited there. But I guess they're going to give us the slides to bones of the leg and the foot. All right. Well, you have, did you know you have phalanges in both your hands and feet? Those are your finger and toe bones. And then in your hand, you have metacarpals instead of metatarsals. Metatarsals are in your feet because tarsals are feet bones and carpals are hand bones. Just something to keep in mind. And you can see how all this lays out. You have a femur, a patella, which is your knee bone, or your kneecap, if you think about it. Have you ever heard the phrase kneecap? That's your patella. Tibia, fibula, tarsals, metatarsals, phalanges. Your femur has something called an acetabulum, and hopefully they'll give us a graphic on that. If not, there's one in your book. Your tibia has a medial malleolus, and your fibula has a lateral malleolus, as well as talus. Your tarsals have a calcaneus and talus. Notice that there's talus bones in your tarsals and fibula. So let's look at our vocabulary. We have lots of them. We have acetabulum and acromion. We have plenty of things about bones. Sorry for the rattling. I have a cat here who seems to think he should be on my desk playing with my pens and pencils. Fred, no, no, no. Come on, behave. Bone depression, bone process. Calcium, cancellous bone, cartilage. Collagen, compact bone, cranial bones. Diaphysis, disc. Epiphyseal plate, that's your growth plate. Epiphyse, facial bones, fontanelle. When a baby is born, they have what's called a soft spot in the back of their head. It's where their skull bones have not grown together yet. And you don't want them to grow together yet because they need that to be able to survive the birth process and be a little bit flexible there at birth. But as a baby grows, those come together and they seal up, and the soft spot goes away. Foramen magnum, Haversian canals, ligament, malleolus, manubrium, mastoid process, medullary cavity, metaphysis, olecranon, orthopedist, osseous tissue ossification. Ossification, osteoblast, osteoclast, periosteum, phosphorus, physiatrist, not a psychiatrist, but physiatrist. You have pubic symphysis, red bone marrow, and ribs. Sella turcica, sinus, styloid process. Suture, temporomandibular joint, and tendon. Trabeculae, or trabeculae, however you want to pronounce that. Trabeculae, trabeculae. Vertebra, and the plural is vertebrae. It has an E on the end. Your xiphoid process, yellow bone marrow. And now we have a quiz. And the reason I'm moving so fast is we're already at 21 minutes in this video, and we have over 100 slides to do, so I'm trying to move through here quickly. The knuckle-like processes at the end of a bone near the joint are, you might have to go back and study that. The process of bone formation is called. And now we get to combining forms. Remember our combining form equation. You have a combining root plus a combining vowel, and that equals a combining form. And again, we have 2 for calcium right there, right off the start. So make sure that you're aware of that. And here are 2 for vertebra. Notice that, and they're very different. Here are some suffixes. More combining forms. And they have misspelled heel in the second one. Calcaneo, calcaneus. It should be H-E-E-L, not H-E-A-L. It's your heel not being healed. So there's a bit of a spelling error there. And still we have some more. And notice pelv. That has a combining form of an I. All right, so let's talk about pathology. What can happen with bones? A lot of those have to do with growth, as you'll see as we go through here. Ewing sarcoma is a common type of malignant bone tumor. There are some types of sarcoma that are very fast growing and are unable to be treated effectively and essentially mean a very swift death, unfortunately. So if you're interested in learning about sarcomas, look those up and see what you can find. All right, the bony growth on the surface of a bone is extosis. Extosis. And then you have osteogenic sarcoma. That's another one. Osteomalacia. It's where your bones soften inappropriately. Osteomyelitis. You may have heard of someone who has osteomyelitis. They have an inflammation that's secondary to an infection. You often hear about this with diabetic patients who are having non-healing foot ulcers. and they end up with osteomyelitis, and that is part of the bone infection that they have. There's usually some type of bacteria involved in that, and it often ends up um, being amputated, unfortunately, where there's osteomyelitis involved. Not always, but on a fair basis, that does happen. I worked with a physician at one of the places that I worked, and he was doing a lot with ultraviolet light and honey, and he had done scientific studies with his patients, and he had photographs to prove that ultraviolet light used with raw unpasteurized honey was able to work where no other treatments would. And he actually presented papers in San Francisco and in Toronto, Canada, about what he had found. And this was in North Carolina, and we weren't far from Duke University. And they would send their patients that at their wound care center, when they felt like they had no other alternatives, they would send them to this physician, and he would treat them with pretty good success. So osteomyelitis is not definitely an amputation situation, but many times that's the direction it goes if you don't have open-minded physicians who are willing to reach out and try things. Your tallops is a congenital, if you have tallops, it's a congenital abnormality of the hind foot involving the talus. It's also called club foot, more commonly called club foot. And that basically means that someone's foot, in the back of it, how it grew prior to birth, was abnormal. So let's talk about some fractures. What are some types of fractures you can get? Well, you can have a simple fracture, which is just basically the bone is in place, but it has fractured, it's broken. You can have a compound fracture. That's called open, because a compound fracture is actually the bone has come through the skin. That is a severely traumatic situation. So if you hear of simple fracture or closed fracture, that means that there's a broken bone, but it's essentially in place within the body. It just needs to be dealt with. If you hear of a compound or an open fracture, that is much more severe and usually the result of a traumatic injury, and that's where you've got bone coming through the skin. That's not a good situation. You can have what's called a callus fracture, which only happens in the wrist. And that's where the bone is fractured, but it's moved away from where it's supposed to be and is going to have to be put back in place. A compression fracture. You may have heard of someone who is elderly having a compression fracture. As people get older, their bones become more brittle and they become, they have less calcium in them sometimes from osteoporosis, and they can be doing nothing, absolutely nothing, and have a compression fracture occur just because the bone gives out. I mean, they can truly just be sitting in a chair, not necessarily getting up, maybe just moving, maybe just shifting in a chair, and that can happen. It's something that is uncontrollable, unfortunately. So that's why a lot of patients who are diagnosed with osteoporosis are followed closely by physicians and tried to give us calcium supplements and those types of things, maybe some physical therapy if they can. Sometimes they have to wear a harness just to keep bones where they need to be. There are some treatments sometimes that they can do with injection to put some material in there to strengthen it. It just really depends. You may hear of a comminuted fracture of the femur or a green stick fracture of the femur. And you can see from these pictures, a comminuted fracture means you've got all sorts of pieces and parts. An example where this might happen is if someone's in a car accident or a motorcycle accident, and there's enough force hitting that bone that it doesn't just simply break, it shatters into pieces. And a green stick fracture, that's, you can see they're missing a part to it, and you've got some cracks going into other sections. Those last two, the comminuted fracture and the green stick fracture, are most definitely going to require surgery to fix. You're talking plates and screws and all sorts of other stuff in there. All right, let's talk about joints. Articulation, it's the coming together of two or more bones. You have suture joints in your skull. And remember, those are where their skull bones join together from when you were a baby. You had that soft spot, and your suture joints grew together to make your skull stronger as you grew. Synovial joints. Those are freely movable. There's a couple of different types. You have ball and socket in your hip and shoulder. You have a hinge type for your elbow, knee, and ankle. And just a point here, make sure you know that the skull has suture joints and that you have synovial joints that are freely movable. And you might want to study up the fact that ball and socket are your hip and shoulder, and hinge types are elbow, knee, and ankle. I would say this is an important slide. Synovial joints, they have a joint capsule that surrounds bone. They have the ligaments that band those bones together. The bones are covered by articular cartilage to try and ease the movement. And you have a synovial membrane under the capsule that lines the synovial cavity. It's filled with synovial fluid. The meniscus is a crescent-shaped fibrocartilaginous structure that partially divides a joint cavity. Another spelling error there. A joint cavity, not a joint cavity. And it acts as a protective cushion. It's only present in the knee. A meniscus is only in the knee. Bursa are closed sacs of synovial fluid with a synovial membrane located near, close by, but not within a joint. They're needed where sliding must take place, so between tendons and bones, between ligaments and bones, and between skin and bones. This is another really important slide, so make sure that you study this information. Here's a good graphic about a couple of different joints. You can see on one side you have your femur, and you have, this is actually a picture of your knee on both sides, to tell you the truth. And it shows you how the muscle is involved. It shows you how the tendons and ligaments are involved. So we're back to terms. Articular cartilage, articulation, bursa, bursae, ligament, meniscus, suture joint, synovial cavity, synovial fluid, synovial joint, synovial membrane, tendon. Quick quiz. The fibrous connective band that binds muscles to bones is, we kind of studied this, and this will be an important one for you to know. All right, whoops, I'm sorry, flew right past that. We have combining forms again. Ankylo and arthro. Notice that arthro and articulo both mean joint, and they're spelled differently. They look differently. So, and interestingly enough, on articulo, I would say articulo, but articule, they don't give us a combining vowel. I'm curious about that, and would direct you to your book to look further. Then you have some more on the next page. Look, you've got 2 for tendon, and they are different as well. And these are some suffixes. So they say combining form, but they are suffixes to me. All right, talk about pathology again, but this time let's focus on joints instead of muscles. We've got arthritis. Anyone heard of arthritis? It's very common. It's the inflammation of any joint. There are types of arthritis, as you can see from here. There is ankylosing spondylitis. There's gouty arthritis. There's osteoarthritis and rheumatoid arthritis. Osteoarthritis is the most common type, and it usually shows up in older people who have had a lot of activity with their joints. It shows up in younger people, professional sports athletes, especially when they are in their 30s, 40s, 50s, because of how much use their joints have gotten. So you may hear about it with them, but typically maybe 60s, 70s, 80s, those types of years, patients see they start to really notice with some joints, not all joints. Um, Rheumatoid arthritis is an autoimmune disease, and that is where your own body starts reacting against the joint tissues themselves and attacking them. It's a very, very painful condition. It can happen in your 30s, as young as 20s or 30s. It can happen later in life, but it's usually, I would say, well, probably 30s or 40s that it might get diagnosed. There are medications for it, but as you can imagine, in order to stop the autoimmune reaction, it lowers your natural immunity. And so patients who are on rheumatoid arthritis drugs also struggle with immunity issues. So if you know someone with that, or if that's of interest to you, go ahead and study that. Gouty arthritis comes with patients who have gout, which means they have high uric acid in their body, and that attacks typically their feet and legs, mostly feet, and it's just unpleasant. They need to lay off the ice cream and the sweets and the rich foods. If they love, say, Italian foods with heavy, rich cream sauces and things like that, those are the types of things that can raise your uric acid and end up setting it off. And then ankylosing spondylitis is something that is a chronic progressive stiffening, and it usually attacks the spine. I don't want to say attacks, it usually focuses on the spine, I should say. So what does it look like if you're looking at a normal joint versus one with osteoarthritis from aging and use of the joint versus one that has rheumatoid arthritis where you have that attack, that autoimmune attack? You can see that they're very different. Some other things that impact joints. Has anyone ever heard of someone saying, I need to get my bunions taken care of? A bunion is a swelling on the medial aspect of the joint between the big toe and the first metatarsal bone. And you can look that up and learn all sorts of things about bunions if you'd like. Once they get to a certain point, usually they have to be dealt with surgery. Carpal tunnel syndrome. Has anyone ever heard of carpal tunnel syndrome? Those of us that use keyboards an awful lot, keyboards and mice with computer work, over years and years and years, the medial nerve gets compressed and eventually it has to be released. So you may hear of people who have had a carpal tunnel nerve release, or a carpal tunnel release, or those types of things. Dislocation. You can actually dislocate a bone from a joint. Who has ever heard of someone getting their shoulder dislocated? Very, 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 very painful. But thankfully it can be slipped back in place. But once you've had a bone that has been dislocated from a joint, unfortunately it's been stretched to a point where dislocation can happen again much more readily than it ever would have. So something just to know. So let's take a look at your joints for carpal tunnel syndrome, since that's a very common thing. There are exercises that you can do. You can look those up about trying to massage that opening. Sometimes if you've been on the computer for long, long hours and you notice you're starting to feel kind of fuzzy there or tingly or numb, you can do some massaging to ease things up. But the best thing is to stop what you're doing. Take a break. There is something called a ganglion. It's a cyst, a ganglion cyst. It's a fluid-filled sac that arises from the joint capsule or a tendon in the wrist. So you may hear of someone who's had a ganglion cyst removed. If it's not bothering someone, they can usually get around it for a while, but eventually it may impact their ability to use that joint, and so they end up having it removed. Herniation of an intervertebral disc. This is something you don't want to have happen. Has anyone ever heard of a slip disc? This is where the disc pushes out into the neural canal or against the spinal nerves, and it's incredibly, incredibly painful. Sometimes it can be coaxed back in through a variety of different procedures and processes. But most often, if it's pressing against nerves, it's going to have to be removed. And that means surgery. Although surgery they have come up with is less invasive than it was even 10 years ago. So it's amazing what they've come up with in terms of spinal surgeries. Lyme disease is included in here. It is characterized by recurrent arthritis, myalgia, and malaise, as well as neurologic and cardiac systems. It's from a tick bite. And you may have heard that it's really important that if you're out in the woods or you're out in an area that has been known to have ticks, that you check yourself, and if you develop a bullseye rash where you've been bitten, that you go get help, because Lyme disease can have just long impact, unfortunately, and be really miserable. And sometimes it mimics other diseases and it makes it really hard to diagnose. And someone may have been misdiagnosed with something else only to find out later it really was Lyme disease. There are such a thing as a sprain. Have you ever heard of a sprain or a strain? A sprain is trauma to the joint with pain, swelling, and injury to the ligaments without rupture. Without rupture. So it's just pain and swelling and injury. There's no rupture of the ligaments, but it involves a joint. You may have heard of systemic lupus erythematosus, or SLE, or just commonly lupus is how it's called, just lupus. This is a chronic inflammatory disease that does involve joint, skin, the kidneys, your nervous system, heart and lungs, as well as collagen in the tendons, ligaments, bones, and cartilage all over the body. That's why it's called systemic. It's pretty much everywhere. And this one is an inflammatory disease, as it says, and it's chronic. It once you have it, it doesn't go away. It stays for a long, long, long time. And there can be acute episodes with it where it flares up, and it is much worse at times than others. But it's always there. Once you have it, it's always there underneath and different things can cause it to have a severe attack, or as we say, an acute exacerbation. All right, let's talk about muscles. You have three types of muscles: striated, smooth, and cardiac. Your striated muscles are under voluntary control. Think back to your nervous system chapter. Voluntary control. They move the bones as well as the face and the eyes. Then you have smooth muscles. The control there is involuntary. They move your internal organs like your digestive tract, blood vessels, and the ducts and glands. Cardiac, they are not consciously controlled and found only in the heart. So those are your three types of muscles. Again, this is a really good slide to know, memorize, study up. This gives you examples of the different types of muscles, and you can see the muscle cells are very different. But then again, you think about the purpose behind each type of muscle. You think about the heart and how many times it beats. When we studied the cardiology chapter, we talked about the heart and how often it is squeezing and it's pushing and it's closing and it's opening. That's very different in terms of function from moving your arm or moving your leg. It's very different from your stomach and what's going on there. It's very different from your eye. So what do your skeletal muscles do? You can see here's two good visuals for us, graphics that show us the different, a sampling of muscles and what they do. Muscles can flex. They do flexion, extension, abduction, adduction, rotation, dorsiflexion, plantar flexion, supination, and pronation. There you go, some lovely words. I'm going to leave you to study up on what all of those are, but for most of these, you should be very familiar with them as you break them down, ab and ad particularly, and supine versus dorsal. Remember those? This just gives you the movement. It shows you the movement. And again, make sure you know these. You will be questioned on these, so I'm going to point out now. Make sure that you learn these. So we have those terms, abduction, adduction. Make sure you know the difference. They have different meanings and different spellings, and they're awfully, awfully similar. Dorsiflexion and extension, fascia, flexion, insertion of a muscle, origin of a muscle. An origin of a muscle is not that it grew, okay? It's not that where it started. It is where it's connected. So make sure that you know for insertion and origin, make sure you understand how those are connected and what they do. Plantar flexion, pronation, rotation, skeletal muscle. Smooth muscle, striated muscle, supination, visceral muscle. And a quiz question. Movement away from the midline of the body is, and this is away, takes us right back to chapters 1 and 2, where we were learning this information, as well as 3 and 4 with suffixes and prefixes. On to combining forms. Our equation is combining root plus combining vowel equals combining form, and we have some here. And make sure you know how to spell rhabdo. Make sure you don't forget the B or the D, and remember which order they're in, because that's important. And then a couple of suffixes. More prefixes. So what can go wrong with muscles? Well, have you ever heard of muscular dystrophy? That is a group of inherited diseases with progressive muscle weakness and degeneration without nervous system involvement. So essentially it means that there's nothing wrong with a person's nervous system. It's all their muscles. And it's progressive, meaning that they may be born fairly strong, but over time, their muscles weaken and degenerate. And as you notice, it's inherited. These are hereditary. These are genetic. This is not something that someone acquires after they're born. It's something they're born with. That something happened when their genes were lining up, and or maybe they had two dominant genes involved, one from each parent, and that's how this happened. You may remember the comedian Jerry Lewis. who I would say, oh goodness, maybe from the 60s through the 90s, did a muscular dystrophy telethon every Labor Day and would try and raise money for research and treatment for muscular dystrophy, which is, again, a whole group of these diseases. Polymyositis. It's chronic inflammatory myopathy, and they're not quite sure whether or not this one is an autoimmune disorder, and it's being studied and researched. But essentially, your muscles are attacked, which keeps them inflamed, and they're not sure if this is the body attacking itself. Well, some lab tests you may run across. ESR, erythrocyte sedimentation rate, is a common one that I've run across. Of course, rheumatoid factor test to see if you have rheumatoid arthritis. Serum calcium is often run. Serum creatinine kinase. Serum creatinine kinase. I'm sorry, serum creatine kinase. Oh, I can't spit that out. And uric acid test. The uric acid test is for gout. All right, some clinical procedures. Very common to hear about arthrocentesis, arthroplasty, arthroscopy. Bone density testing is done, particularly using heel bones to check for osteoporosis. Bone scans, CT, and MRIs are used. Muscle biopsies occasionally. You may hear of something called an EMG, electromyography, and that is occasionally done to test. And abbreviations. Oh, mercy. We have plenty of abbreviations. Notice that CA here is calcium, not cancer. And DEXA, DEXA, is more commonly used than DXA. Just saying. Out there in the real world, it's DEXA, not DXA. Do hear DMARD used. Disease-modifying anti-rheumatic drug. DMARD. And that's usually for rheumatoid arthritis. If you're into physical therapy, you'll hear of DTRs being tested. You may have heard of NSAIDs, Tylenol, ibuprofen, acetaminophen, Advil, whatever they all go by. Those are NSAIDs, non-steroidal anti-inflammatory drugs. You may, if you have been involved in surgery, heard of an ORIF, open reduction with internal fixation. That means that they took the person to surgery, they opened them up, that means they made an incision, they put the bone back in place, and they did some type of internal fixation. Maybe they put in a plate, maybe they put in some screws, maybe they put in a pin, those types of things. That's ORIF, open reduction with internal fixation. You may hear of ROM for range of motion. That's another physical therapy term. You may hear of TKR or THR, the total knee replacement or total hip replacement. Those are arthroplasty procedures. And that is it. Mercy, it took us almost an hour to get through all that information. I wish I could tell you the next 2 chapters for week 7 were going to be short. They might be a little bit shorter, but there's still a lot of material to get through. So hang in there, and we are on the home stretch. As I said, week 7, just one more after this. And I will be back shortly, and we will talk about the integumentary or the skin system. Thanks.